As a rheumatologist, I often take care of people with rheumatoid arthritis and other autoimmune diseases in the joints. And we come up with specific treatments for each individual patient. We'll decide among many drugs what's best for him or her. And after that prescription, a lot of people don't know that what happens generally is there's a process called step therapy, where my prescription gets reviewed by the insurance carrier, and they'll actually stop that prescription and say that instead of taking that medicine, the patient instead needs to try something different that they've decided first, so-called fail first. So when I prescribe a drug, for example, for somebody with rheumatoid arthritis who needs it to feel better, have less joint pain, get back to school, work, taking care of their families, step therapy delays them getting on the right drug and unfortunately can cause more pain, more disability before they get on the right treatment. In a society where we've created these blockbuster medications that are life-changing, it's really heartbreaking when people can't get access to them. Recently, I was taking care of a young woman with rheumatoid arthritis, and I wanted to provide her a drug that I thought was the safest for her because she was planning to become pregnant. Her arthritis was flaring and she was in a lot of pain, going through a lot. After my prescription was sent to the pharmacy, we were told that she wasn't going to be able to get that prescription and needed to try something else first that would probably be just as effective, but that I was concerned might not be safe in pregnancy. And so I needed to write a letter to the insurer, and weeks later it was reviewed and eventually covered. But during that time, that young lady wasn't on the treatment she needed, and she had a lot of trouble with her arthritis. Step therapy is pretty frustrating for American physicians for two reasons. One, the first and foremost, is that it delays the prescription getting in the hands of the patient. So people with arthritis aren't getting better quicker because they're not on the right drug first. Secondly, for a medical practice or from a physician's perspective, we're often hiring teams of people to respond to the paperwork that step therapy involves. We're spending our own time writing letters, trying to appeal the step therapy denials to try to get the best drug for our patients. And that takes time away from the practice taking care of patients. In rheumatology, we've got a workforce shortage. There aren't enough rheumatologists to take care of the people with arthritis in the US. And so we need to be efficient, and step therapy programs keep us from taking care of our patients. When people find themselves in the throes of a step therapy problem, where they're not getting the prescription that their doctor wanted them to get and prescribed, I think they have a lot of options, and my main advice would be to raise your voice. Tell your doctor, number one, so that your doctor's office knows that the prescription has been denied. Find out what the appeal route is. Is it the doctor making a call, writing a letter? Can you write a letter on your own behalf? Advocate for yourself. And whatever you do, it's often helpful to engage other people. Find out if other people have been in this situation with the same insurance company. If your insurance is through your employer, it always helps to tell your human resources department about that specific insurance company that didn't let you get on the treatment you needed. Copy your insurance commissioner, your local state administrator who regulates insurance, about the problems that you're having. And stand up for yourself. We're living in a time where public officials, Congress, and people representing all of our patients in state houses across America have started to realize the problems with step therapy. We're seeing a lot of legislation at the state level and legislation in the previous Congress, and we hope in this Congress, that will help to reform step therapy. But we've got a lot of ground to cover, and I encourage people to get involved and tell their members of Congress, their members of the state and local legislatures to get involved.